I remember very vividly one Sunday morning, my late husband collapsed and we had to travel to Riverside. And I remember driving on the James River Bridge and seeing the water that day on the river. It was a beautiful day, and I thought, wow, my life will never be the same. That ride to Riverside was probably the longest ride of my life. It was a Sunday morning, we were getting ready for church, and we were really excited because we had spent a very long weekend with youth soccer and just going different ways with two small children. I heard something collapse, and I called out to my husband, but he didn't respond to me. I think I remember at one point the EMS said, just get her in the car. And I'm like, what does that mean? Just get me in the car. And they did. From that point, we had a 25-minute drive across the bridge, which I think about how our volunteer firefighters and EMS workers sacrifice every single day to transport those who are experiencing a medical emergency. And so in that day, my life, my future was in their hands, and they transported me there safely. Once we arrived at Riverside, it was still very surreal. All I can say about Riverside is that the doctors, the nurses, everyone in that moment just made sure that we were going to be able to survive to the next step. And so I will always be eternally grateful to Riverside for the care that they provided. When I found out that there was going to be a hospital here in my community, all I could think about were hundreds of people who are going to be fortunate enough to get care immediately. Particularly with cardio, every minute counts. And so having a hospital that is 5 to 7 minutes away versus 25 minutes away will absolutely save lives.
Many times transporting critical patients, we've been tied up on the bridge and bridge lifts, and patient care was delayed. This facility will change transport times and availability of medic staffing in Allouette County like we've never been able to experience before. Not only did we have long transport times were just a part of it. Once we got across the bridge, a lot of times we go lights and sirens so we can get there fairly timely through the traffic and the intersections. This facility, for the first time in my 38 years of doing this, will give us the ability to transport a patient to the hospital, put the medic back in service, and it remain in its district the whole time.
Our father grew up in Smithfield, and Mom came to Smithfield and met Dad. Dad purchased the property in 1945, right before they were married. They lived there together for 50 years.
So after Mom's death, we kept the house for a while. Then we decided it was time to sell. And Riverside was interested in that corner property. We knew that we wanted to do something to honor the memory of our parents and our childhood home.
Right before we got ready to go to bed that night, we walked through each room and just talked about different things. And when we got to the kitchen, the chalkboard was empty. And I said to Elizabeth, I said, we need to think of something to put on that chalkboard. And so we came up with, we're looking forward to a beautiful hospital. And as you can imagine, it was mixed feelings that night, spending the last night at your childhood home. But it was a good feeling to know that it was a hospital going on the property and would be available to the residents of Allouette and Surrey County.
Where you live shouldn't determine your health outcomes, and residents who reside in a rural area deserve the same level of care and access to that care as one would who lives in a big city.
One of the largest factors into what actually contributes to health outcomes is your zip code. So where people live actually dictate more about their health outcomes, their mortality, and how ill people will be. So bringing a hospital closer to the community is going to change the health access that patients have, and that's going to really improve the community's health.
In communities like ours, minutes can be the difference between life and death, and that's why residents residing in our county deserve high-quality access to both inpatient and emergency care when they need it, and as quickly as possible. Hospitals across the nation are facing unprecedented pressures, including rising costs, declining reimbursements, workforce shortages, and rapidly evolving technology. Riverside has really leaned in and is leading with purpose to continue investing in our communities, investing in our teams, and investing in our facilities. It's the right thing to do. It's the right time to do it.
We want to make sure that people have access to primary care and specialty care closer to home. Having that access to healthcare is going to give people the ability to not only have preventative medicine, but treatment to their chronic conditions. And of course, that's going to equate to more healthy patients and outcomes.
Growing up in Smithfield, when Smithfield was a much smaller place, we were fortunate enough to have the two great doctors, Dr. Jameson and Dr. Longford. And truly back then, when you had an emergency, you didn't go to the hospital. You called Dr. Jameson and Dr. Longford, and they met you at the office, and it didn't matter when it was, day or night.
I feel as a physician that anytime you're getting care close to home and have access, that you're going to get better care. I also think that having physicians in the community who are serving that population means that your neighbors are taking care of you. As physicians get to know patients on that level, they can provide more comprehensive care.
With the unified health system, it allows us to have preventive services for our patients across the health system and decrease those gaps in fragmentation in care. We also have one electronic health record. So from primary care to our specialists, our providers are able to see your goals, able to see the care that you've received, and then build on that care.
So philanthropy brings the gap closer with providing care to patients and being able to fully execute our mission of providing high quality care. There are numerous challenges in the country right now with reimbursements, insurance companies, and it makes it harder for a hospital to operate. So the foundation is pivotal in being able to provide those resources to patients in the community.
Our communities and our patients deserve access to high quality care close to home. They deserve access to innovative technology, and they deserve access to world-class providers. And private funding helps us do that. It helps us reduce those barriers to care, improve access, improve innovation, and make sure that we are turning our mission into reality.
Private philanthropy is meaningful because it bridges the gaps of service for our patients, and it allows our patients to be supported with durable medical equipment, outpatient services, treatment, and it also allows them to have follow-up visits that we can provide transportation for, and that may even include chemotherapy.
Your support accelerates everything from advanced diagnostics to innovative programs and technology that will save lives.
I can't help but to think what would have happened if we had a facility that was closer to our home.
You have the power to strengthen care here in Isle of Wight. Together, we can turn our mission into reality.
Not having to battle the James River Bridge or traffic down 10 or traffic down 17, but just right here in our community. I think that's a big win and something to celebrate for all of Isle of Wight County and Surrey County residents.
Join me in living our mission to care for others as we would care for those we love.
All units in Isle of Wight County, Surrey County, and the city of Suffolk, please stand by for a historic announcement. As of this moment, Riverside Smithfield Hospital is officially open and accepting patients. For the first time ever, our community has a hospital of its own. EMS units may now begin transporting to this facility under standard protocols. Today is more than an operational milestone. It is a defining moment in the history of Isle of Wight County.